Activities of daily living, ADL, are essential tasks that enable individuals to live independently and improve their quality of life. The ultimate goal of rehabilitation is to help patients achieve the highest possible level of function and independence in these activities. Therapists use principles of motor learning and motor control in PNF treatment to help patients regain mobility, stability, and skill in daily activities. Feedback, practice in meaningful contexts, and allowing mistakes are key to optimal functional performance. Therapists must decide when to provide hands-on assistance and when to step back, allowing patients to perform activities independently. The ultimate aim is for patients to master ADL without external help. Motor learning progresses through cognitive, associative, and automatic phases. In the cognitive phase, therapists provide extensive input. In the associative phase, input is reduced and the environment is varied. In the automatic phase, patients perform tasks independently, even while multitasking. Mastery of ADL is a crucial step towards patient independence. Skills such as rolling, bridging, crawling, kneeling, sitting, standing, walking, and self-care can all be taught using the PNF approach, with guidance and resistance to develop effective movement strategies. Transferring between surfaces is a fundamental ADL. Patients practice moving from wheelchair to bed, bed to wheelchair, onto the toilet, into a shower or bathtub, and into a chair or car. Guidance and resistance at the pelvis are used to facilitate safe and effective transfers. Dressing and undressing are vital daily activities. Patients practice taking off and putting on shirts and pants, with facilitation to the arms and assistance in bridging and reaching for clothes. These skills are essential for self-care and independence. Performing activities in the kitchen represents a higher level of independence. Patients practice tasks such as preparing food, reaching for items, and using kitchen appliances, all of which require coordination and functional mobility. Understanding key terms in PNF and rehabilitation is crucial. Concepts such as approximation, bilateral movements, irradiation, muscle contractions, and reinforcement help guide effective therapy and patient progress. Familiarity with rehabilitation terminology enhances understanding and application of therapy techniques. Terms like after discharge, chopping, groove, diagonal, hold, inhibition, and more are fundamental to effective practice.